campaigns against low pay has been that driven by cleaners, food service workers, orderlies and home support workers in the public hospitals. This campaign was about winning on two major issues. One, a national collective agreement, or MECA, a multi-employer collective agreement, with a single set of pay rates and conditions to replace the 43 collective agreements containing multiple pay rates and conditions that were currently in place. Two, a big increase in wages and penal rates to restore what these workers had lost during the national governments of the 1990s. The Healthy Pay for Healthy Hospitals campaign was launched in May 2006, and although bargaining started in June 2006, it soon became obvious that the district health boards and contractors were all opposed to a MECA. Because of this opposition and the large pay increase that we were demanding, we knew then that the campaign was going to take some time. While our members knew that they had the support of the Labour government, we also knew that we needed to generate a public groundswell of support to get what we wanted. Hospital members organised themselves around recruiting non-union workers, talking to other unions, lobbying DHBs and meeting with politicians to explain the justice of our claims. During the winter of 2006, some members said we were being too bold and that gaining a 25% pay increase and a MECA would never happen. In December 2006, we held a short national stoppage for all our public hospital members to express our national unity and resolve. In February 2007, after intense political lobbying, the DHBs agreed to negotiate a DHB-only MECA and indicated that there may be a significant amount of government money to address the low pay rates for our members. This turned out to be a total of $16 million. With the contractors pressuring the union for individual employer negotiations, the union launched an urgent employment court case to seek a ruling that the DHBs and contractors had to conclude a MECA with us. Notices for national rolling strikes were issued by the union, and the response was lockout notices from all four contractors. 3 of the contract companies demanded that we withdraw our claim for a MECA. Spotless wanted some union members to agree to stay at work during the strike for health and safety reasons. Members refused because this would make the strike useless, and they were duly locked out. Our members refused to bow to any of the threats from the contractors, and with our political support increasing, the DHBs presented an offer for a base rate of $14.25 an hour, and the employment of an auditing company to make sure that the government money had been fully distributed. The contractors were stunned by this rapid movement in the wage rates, and 3 of them signed letters of intent with the union to pay the same wage, penal and overtime rates and the same agreement term as the DHBs if the government money was passed on to them as well. Spotless, however, thumbed their noses at the union and refused to sign the letter of intent. Spotless's offer was to pay new workers up to $1 an hour less than the others, and they wanted to put new staff through a competency assessment before paying them $14.25 an hour. When the union wouldn't agree to this, Spotless carried out their lockout of our members in 16 hospitals throughout the country. The staunchness of our members, the appearance of Labour MPs and even cabinet members on our picket lines, and the wider union and community pressure on the isolated Spotless made them think again. Spotless threw in the towel even before the employment court injunction decision was announced. Spotless finally agreed to pay the same wage rates, penal and overtime rates and agreement term as the other contractors. While we haven't finished this campaign, our victory against the biggest bully in the playground has had an effect on the attitude of other employers to our union and has increased the confidence of low-paid workers that they can win as well. These 3 campaigns have taught us that if we are to have substantial gains for low-paid workers, we need the following. 1. Members who are prepared to take on the fight. 2. The organising commitment from the union or unions involved in the campaign. 3. Wider union, political and public support for our demands. And 4. An identification and ability to use whatever levers are necessary to win. The Service and Food Workers Union, your union, is proud that with the support of the Labor government, we have made important gains for low-paid workers in 2007. With this enthusiasm, experience and continued support, we hope that we can spread this to other low-paid groups, such as school cleaners, in 2008.